So today we have Robin Slater with us. Robin is a union organizer. Before we start, Robin, please introduce yourselves to the audience and explain what your role is with the union.
Okay, thanks, Kearney. My name is Robin Slater. I work with SEIU Healthcare Pennsylvania. I have been a union organizer for over 25 years, and I've been working in home care division for 10 years now. And what I do is I enforce the contract, but I also get home care workers together so we can fight for issues that concerns them.
And so you're a part of SEIU, which is the Service Employees International Union.
Yes.
Can you share with our audience what is the purpose of a union and what are some of the issues that the union is fighting for during this coronavirus? Help.
I'm actually, although I work for SEIU Healthcare Pennsylvania, there's a division under SEIU that's called United Home Care Workers of Pennsylvania, which services over 20,000 home care workers throughout the state of Pennsylvania. And what we do is we service them. We actually go and talk to home care workers about what is important to them, raises, trainings, PPE equipment, because as you know, home care workers were deemed essential personnel. When the COVID-19 started, we had to revamp everything. So we actually talk to our home care workers through something like this, which is the Zoom. And we have lobby visits, but right now we have for hazard pay for home care workers. PPE, we are mailing out PPE equipment to home care workers that are on the front line. We're making sure that they know about the unemployment status, where if you have childcare issues or you have been exposed to COVID-19 or someone in your family has COVID-19 and you have to take off work and this loss of hours, you are able to apply for unemployment. A lot of home care workers didn't know that. So we kind of putting that information out to them, making sure that they know exactly the things that they can do and where to go to for support.
Now, you mentioned PPE, which is personal protective equipment for the essential workers. I wrote down some notes because I've learned of some information today that I just want to talk with you about. I learned of today that the federal government is considering rolling back infection control requirements in nursing homes, particularly during this time, during the virus. With that said, infection is the leading cause of death in nursing homes.
Mm-hmm.
And the coronavirus, I just have these stats I want to go over. Some states haven't listed data on the COVID cases in nursing homes.
Mm-hmm.
4,000 nursing homes have been counted out of approximately 15,000 plus nursing homes, and about 28,000 assisted living facilities. Within the nursing homes, 16,000 residents have died thus far, or that number might have grown. And approximately 97,000 residents and staff have tested positive for the coronavirus. And there are more than 5,000, approximately 5,700 facilities in 46 states that has acknowledged that a worker or a resident has contracted the virus through that facility. Mm-hmm. So we know that there has been a lack of data and a lack of testing. And just last week, the Centers for Medicare and Medicaid Services just said that they would require the nursing homes to inform the residents and their families within 12 hours if a resident has contracted the coronavirus. Mm-hmm. So we know that there was a point in time up until last week that residents were infected and that news wasn't being shared with the home care with the workers or the families. Are you able to speak to that and maybe some of the concern that you're hearing from the essential workers?
So, of course, I'm in the home care division. Nursing home is a little bit different, but we have had calls that included nursing home workers, CNAs, dietary, housekeeping, and they all are scrambling to get PPE. There's a lot of deaths that pretty much that is either I won't say just don't report, but I think it's a delay in reporting how many deaths that are in nursing homes, along with how many people are have been exposed or are considered positive for COVID-19. In the home care division, where home care workers go into someone's house, they don't have the ability to go and say, well, you know what, let me be 6 feet apart from this person that I'm taking care of. They have to take care of people up close and personal. One of the issues is that they don't have the PPE equipment in order to do that. At least at one point when this first started, it was a lack of PPE throughout Pennsylvania, and we talked to the state and we said, listen, we have to get PPE to our home care workers because they are really frontline workers. They come in close contact with people every single day. We have home care workers and clients that have passed away of COVID-19. So it's not this is something that's really, really serious. And so we have been real diligent about making sure that home care workers are well protected. And I can say, at least not to my knowledge and all the calls that I've had, there hasn't been a high number of deaths in particularly the home care part of it. I think mainly because of the quick response that we've gotten from really making sure that our home care workers are protected and making sure that knowing the signs, like doing the trainings on how to wear proper PPE, how to discard gloves, how to constantly wash your hands, what to do, what kind of signs. We are like allowing them, giving them trainings every week on how to identify if someone is exposed to COVID-19. And I think the quick response that we did after everything was shut down, I think that saved a lot of people. But in the nursing homes, as you know, they don't have room to move around. So they're pretty much, if someone is in there positive of COVID-19, because of the close proximity of the nursing homes and how they're short-staffed, how overcrowded they are a breeding space for people to contact their virus and get very, 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 very sick, which is they're already sick in our nursing homes.
And this is why I wanted to have this discussion with you, being an organizer and part of the union, is because I wanted to talk with someone who is up close and personal with some of the essential workers. I know that for those of you who don't know, SEIU represents various employees, all service industry workers. Robin, as she stated, she's within the home care division. So with all of the different news that we're hearing, with states preparing to open and businesses opening, I wanted to talk to you to share with the audience firsthand what this section of the population is experiencing. Can you share with the audience some of the concerns that home care workers have and some of the maybe unsatisfactory situations that they're currently going through right now?
A lot of home care workers are afraid. So when you have a home care worker that is a single parent, daycare becomes an issue. Because now the schools are closed. So now you have to figure out like how I'm going to take care of my children and how am I going to protect myself when I go into this client's home and then when I come back to my house. So it's a wide range of things. How do I pay my bills? because now you have, not only do you have to take care of your children are home, so you got to buy more food because there's more, everybody's at home all day. So the food bill goes up, your utility bills goes up, and your pay doesn't. So how do you deal with that? And people are struggling, and people are struggling to pay their rent. People are struggling to buy food. People are in the city, you know, especially in Philadelphia, we're so huge. It becomes a fear factor of can I still do this work and survive? Because now you have the public transportation system that is not working up to 100%, and people are getting on a bus. So if I have a mask, if I only have one mask and I'm taking this one mask and I'm saying, okay, this is the mask that I got to use for my client. This is the mask that I got to use to get on the bus. This is the mask that I got to use when I get off the bus. That is so not safe. Like that fear of how do I keep myself safe and how do I keep my family safe is a fear that home care workers go through every single day because of their close contact. And most home care workers travel. They travel on a bus. So they expose themselves in all kinds of ways that other people in other situations don't. And even, you know, we service hospital workers, we service correctional facility RNs. So we service those healthcare workers, and they all go through the same fear. They don't have enough equipment to protect them from, you know, for them to do their work.
And I think this is really, really, really important to hone in is that although we may be hearing different information about PPE and what the hospitals need and nursing homes need, the fact is, hearing from a union organizer who works closely with the healthcare industry, there still is a need for PPE. And that PPE includes gowns,
Mhm.
masks,
Gloves,
gloves,
sanitizer,
all of that.
all of that. Yep.
So, with the issues that the workers are facing now during this health crisis, what are some of the main concerns that the union was fighting for prior to the health crisis? And have those issues gotten worse as a result of the crisis?
So before the crisis, we fought for better wages, trainings, um, healthcare insurance, and in some of those instances, we got those things. After COVID happened, when you have home care workers that don't have healthcare insurance, then the fear is if I get sick, what happens? Because that bill is still going to come. So that's still another bill for them. Um, and the things that have stopped is we we turned it around in reference to the trainings because we won trainings for home care workers to actually have trainings. We did CPR trainings, we did nutritional trainings and stuff of that nature to make sure that they're not only taking care of themselves, but they taking care of their client. The trainings have kind of came to a halt, and we're now trying to figure out like how do we continue to train home care workers that they feel safe and utilize the monies that the state had gave us in order to make those things happen. One of the home care agencies that I service, that I represent, that we have a contract with, I'm having calls with them every week about how do we make things better for the home care workers. And within that agency, they did something like a hazard pay. What they did was they filled out, they requested monies from the state, and the state uh, uh, gave them these monies, and they gave it to the workers. So all of the workers that work from have received a $750 bonus. They also received an extra $2 in wage increase, and they also had $50 a week for 8 weeks for transportation costs to get back and forth to work. That wouldn't have happened without without the conversation between the union, not only me, but other home care workers on the phone with the employer, because they heard what they were saying. Like, I'm out here every single day doing this work. I need to be able to be protected, and I need to be able to provide for my families. And so in turn, they came and they told them, we heard you, and this is what we did. So I think that that is something that home care workers are asking for, and they need the extra money, because they are essential workers, and they don't have the ability to say, you know what, I'm not going into work, because that person that you take care of is dependent on you to come through that door every single day.
I think that's amazing, what the union and the home care workers were able to accomplish with that one agency.
Mhm.
What are some of the other wins or victories that the union has had prior to COVID and since, like you just mentioned, that has been since the health crisis. So can you name some important victories that has taken place prior to COVID and other ones after or during?
So a couple of things. Prior to 2016, home care workers were not considered under the labor law workers. So before that, they were not entitled to overtime pay. We won that law in order to consider home care workers. They do work, and so this is a job, and they now are, it's against the law not to pay you overtime pay, because you are considered in that law. It's a job, it's an employment. We also have won $4.3 million in wage increase for consumer directed workers, which is the workers that work for a client that are under public partnership. So they actually they get paid by a agency, which is PPL, and they're under the state. So DHS is the people that we talk to, which is underneath the governor. And we talked to him about, those are three things that we wanted. We wanted better wages, we wanted trainings for home care workers, and we wanted healthcare insurance. We won two things. We won the wage increase, and we won the trainings for home care workers. We won about $1.2 million for trainings for home care workers, and we're still finding ways to utilize that. We've also won now, so in 2021, there's going to be a change in how healthcare is given to Pennsylvanians, and that's something that was won by home care workers, because they were saying, like, listen, the marketplace is too expensive. And so what they did was they brought, instead of it being a federal program, it's going to be brought back to the states. So in that turn, the states will be able to make things cheaper for affordable for home care workers, or for anybody that needs healthcare insurance. And we've done, we've also, and I'm sorry because there's something blank, as I know we've done so many things, and I'm like, home care workers are having a voice. They are we have given them the ability to kind of say, listen, you are a voter, you work, and you have every right for your voice to be heard. And so with that, we give it, a lot of times home care workers think that they're by themselves, but you're not. You have a lot of people that is behind you and on your side, and they depend on home care workers to do this work. So we need to make it better, and we need to make it better soon.
What do you say to those who are against the union of any sorts, but particularly we're talking about home care? What do you say to those people, or some of the leaders that are against unions?
I think that people have a bad, they think, a lot of people say, a part of a union is like, unions take your money, they take your money, they take your money. The union dues in the home care workers in the home care workers union is very, very low. We make it low because we understand the wages. We understand the fight. I've been a union member for 25 years. In that 25 years, I know exactly how they spend my union dues. And I just think that, for us, for home care workers or anybody that says, you know what, I don't want to be a part of the union because the union just takes my money, but in reality, we don't. The dues are only for the running of the union. It doesn't do anything else. It doesn't we don't try to take anything from anyone. In the same turn, we bring back to the home care workers to make them stronger, to make the changes that you need, and to make sure that, you know, to have the ability to say, you know, things are possible. Washington State, which is a home care workers union, home care workers in that state, they make between $14 an hour. They have a 401k. They have health care insurance. Have those things, not because the governor there said, you know what, oh, let's just give home care workers this. They did that because home care workers stuck together and said, we are important. This is what we deserve. In Oregon, the same thing. They have a health care insurance. They have a salary of $14 to $17 an hour, health care insurance, 401ks, and those things are possible. It's not impossible. There's nothing impossible as long as we stand together and have one voice and we're saying the same thing to everybody. I think that, you know, for my understanding, you can get anything done as long as everybody is on the same page.
And I think that what you're saying is so powerful because you have been able to share the concerns of home care workers, but then also talk about those victories that were won and would not have been won had it not been for the union, which is made up of workers. And would you say that the workers pretty much, I don't want to say run as far as control, but everything is passed through the workers. They make the decision, you know, they have a very direct say in what happens. And that's how you're able to achieve the things that home care workers need because they have been able to openly voice what it is that they need. And in turn, the union has been able to fight for those things.
We it can't happen without them. It just can't. I am not a home care worker. I don't know your plight. I don't know what you do every single day. People need to hear what you do. They need to feel what you do. You know, I always tell people this story because my first introduction to home care was with my great niece. My great niece was born with half of her brain missing. She couldn't walk, she couldn't talk. She had a smile that would light up the room, but she couldn't do any of those things. I saw how my niece struggled to keep her in her home. I saw how my niece struggled to get equipment for her, get her to in schools, and because everybody was telling her, you know what, you should put her in a nursing home. She chose not to do that. They also told her that she wouldn't live past 3 years old. My niece lived until she was 19. And that's only because of the care that she got while at home. Had she had been in a nursing home, I don't believe my niece would have been here that long. And I always tell home care workers, your work is important. And we can't do any of this without your input or your help. One of the things that, and we were talking about things that we've won, we now have a pre-service orientation. That wasn't something that right now they were just, before that, they were just throwing home care workers into a home and saying, okay, go ahead and do your work. We just won pre-service orientation. We had to win that on a Supreme Court level. We had home care workers in the Supreme Court telling their stories as to why that training was important. And we won that. Now it's going throughout the state of Pennsylvania. Like we have those going on every single week. Before COVID, it was every day or every other day we had trainings. Now it's like 3 times a day we have trainings. As a matter of fact, I have one at 3:00 today. But we couldn't have won that without home care workers. That's not something we just couldn't have, because I don't do your work and I can't tell your story. Your story is the most important thing that home care workers have, because without your story, nobody is never going to understand the things that you go through. The people in Harrisburg and the people in the state level and even in the federal level, they will never know what you go through day to day unless they walk in your shoes. But the only way that you can make people walk in your shoes is to tell your story.
And I have experienced firsthand myself the union, and as a caregiver for my family members. And I remember before the union was formed, I remember that was one to even have the ability to form a union.
Yes.
And I remember when the overtime was passed, but then there was something with that you couldn't live in the same house, but
Yeah.
at least the overtime had, that was passed, because as a caregiver, most people have no idea, like you said, what you go through. And you said they don't look at that as real work. I remember as a young woman, when I first became a caregiver, I was taking care of my grandfather and my grandmother. And during that time, there was no in-house pay, unless you directly came from an agency. There was no direct consumer type pay. And I've watched the entire industry, being a part of it directly myself, and not being a part of it. I've watched it grow into what you said now. It is a real profession. People get up every day and do hard work. It is hard on you emotionally. It is hard on you physically. And you can't take days off because you won't get paid. And not that you know, you want to take days off, but you need a day off. You need a break. You can't work every single day, particularly during that kind of work, and not have a break. So I think the work that you all are doing is wonderful, and that is why I wanted to speak with you, so that other home care workers, other caregivers can understand what the union is all about, and what the union is for, and for people who also just didn't know that this union existed. What would you say is the hardest part of the work that you do?
It would definitely have to be the listening piece of it, the mental piece, because as I tell my story, I had a couple of people pass away from COVID-19 that I was really close with. And when you start to hear that, not, in my life, and then you start to hear nursing home workers saying, I can't get equipment because I don't feel safe and I have to work. And if I don't work, I can't take care of myself, or I can't take care of my bills. But then if I get sick, who's going to take care of my kid? It's like it's so hard. And for me, it's really, it's an emotional piece that you just have to listen and feel it. It is no way. I think that's about the hardest thing for me, as far as listening to stories of home care workers say how much they're struggling, and me not having the ability to fix everything, because I get so angry at the people that makes the decisions around home care, because when they say that this is not a real job, or that they're just glorified babysitters, they only sit around and watch TV and watch someone. And I'm like, that's not true. Because when you go into someone's home, you may be the only person that they've seen. And you're still giving them a quality of life so they can go out, go to the store, have someone to talk to. And if you were not there, it just wouldn't be, it's not fair. And I think that's another thing that actually angers me, to the point where when you have legislators say, well, they don't need a rate increase. They don't need health care insurance. They don't need, but they do. If you are in that situation when you get older and you're going to need someone to take care of you, you're going to want someone that has the ability, that's capable, and is not just doing this for the money that comes with it. You want a caring person. And I think that all home care workers care about the people that they take care of. It's just so unfortunate that we don't have legislators that really care about them. And we have to really ask the people that is your representative or the people that's in your state to say, how do you feel about home care? Where do you stand in on the support of home care? Because I need better wages, I need healthcare insurance, and I need trainings, because I deal with people every single day. And if they're not doing what you need them to do, then we have the ability to get them out of office. But that's my most thing, because I deal with that every single day, listening to people say how home care workers this is not a real job. And it is a real job. You do take care of someone, you take care of another human being that needs your help. That's a job.
And I think it's also important for other everyday people to know the issues and the concerns that go on with home care workers and caregivers, because the majority of people, unless you are experiencing something, it's kind of like out of sight, out of mind.
Mm-hmm.
You have no idea what another person is going through if you don't have a connection to that. And unfortunately, sometimes we don't even open ourselves to experience what other people are going through. So there are everyday people whose loved ones are in these nursing homes, and they ought to get involved and understand what home care workers and nursing home staff, what they're going through, because what they're going through affects their loved ones.
Yeah.
When you are short staffed in nursing homes or hospitals, that means that your loved one cannot get the attention that they deserve because the nursing homes are short staffed.
Mm-hmm.
When the workers are not receiving a substantial amount of pay, you get burnt out.
Mm-hmm.
When they don't have paid time off, when they don't have paid sick leave, you get burnt out.
Mm-hmm.
And a burned out caregiver is no good to themselves or
mm-hmm.
the patient or resident that they're taking care of.
Mm-hmm.
And I know how I've been a caregiver, so I know firsthand that exhaustion that comes with it, the physical exhaustion, the mental exhaustion. You care about your patient, you care about your loved one, and you would rather you take care of that person
Mm-hmm.
than anyone else.
Exactly.
But when you are not given the right tools or equipment or the pay, everybody wants to get paid a decent amount of money.
Mm-hmm.
I mean, the fact that people get up every day and go to work for low wages speaks volumes in itself. I mean, that concept, the fact that you get up every day,
mm-hmm.
take 1, 2, 3 buses, different modes of transportation,
Mm-hmm. Mm-hmm.
go to a job
mm-hmm.
that you're not receiving benefits or a substantial amount of pay, and you get up and you do it every single day, that in itself,
Yep.
I believe, speaks volumes.
It does. It does. It does. It's like when you have home care workers that have multiple clients and they're on traveling all day. When you have a home care worker that gets up at 9 o'clock in the morning, they don't get back home until 7 o'clock at night because they're traveling from one person to the other. When you have you're taking care of a family member and you're taking care of that person, although your hours may say 9 to 5, but you know full well if you're in their house with that person, your job does not stop at 5 o'clock. Have home care workers that had good jobs, like, working with Verizon and working with the city, and something happened to their child where they were like, don't put me in a nursing home. Like, can you just take care of me? Like, and then it actually costs the state less to pay a home care worker than to put a loved one in a nursing home. It costs the state more money, but they just refuse to acknowledge that, or just really give home care workers the accolades and the things that they need in order to continue to do this job. This job is going to be around for a long time. And this COVID-19 made it so apparent how important home care workers are, how important healthcare workers are. Because at the same time, while they're all running around trying to figure this out, home care workers got up every single day and still went to go see their client. Although they may not have had the PPE, they may not have had the money to get, but they made it happen. And I think that, that's something to say, just like you said, it speaks volumes of the value and the importance that people feel that take care of someone else. And they say, you know what? This person depends on me, and I need to walk through that door and make sure that that person sees me. Because at the end of the day, everybody is afraid, and we just trying to make sure that things continue to go on, because when you get older, you want that consistency. You want that same person. You want to make sure that that person is coming in your house. And I just think that, with home care, they are just, to me, they're just angels. I don't know any way to say it, because I don't know if I don't, my mom was sick and I took care of my mom, but not to the extent that I see home care workers like, doing it, like coming in every single day, just putting a smile on that person's face, and they just light up when they see a person walk through the door. And it's like, how you can't put a price on that. Actually, you just can't. And so I always say, if nobody ever tells you how much that you are appreciated, you are appreciated. You are appreciated.
And that's one of the reasons why I started the Caregiver Society, is because, like you said, they put a smile on people's faces. When my grandmother and my mother were sick, I had, on days that I couldn't be here, someone would come in, and I would see, I'm into hair and beauty and things like that, but one of the ladies that would come in and help my mom, she could just make my mother's face up so pretty and comb her hair, and my mom would just glow. She had cancer, so she lost some of her hair. So, you go through a lot of things when you are sick.
Mm-hmm.
And I said to her one day, I'm into all of that, but maybe it's because I'm busy and it's my mom and I'm trying to get her dressed and do all these other things, but you just come in and take your time with her.
Mm-hmm.
And I realized that there were raw talent and skills that home care workers had. And to me, that was a ministry, because you're using these skills that are outside of what you're here for, outside of your profession.
Mm-hmm.
But this is an added skill that you have. There was another woman who, she could arrange flowers. I would come downstairs and I thought she purchased flowers, but she would cut the roses and things from our flower garden. And I just thought she knew my mother loved flowers. And I just thought that was so amazing. And I tell people all the time, there is a difference between someone who is caring for someone versus a caregiver or a home care worker with a true caregiver's heart.
Mm-hmm.
A true caregiver is someone like the home care workers who you don't have to tell them to do something. They go above and beyond.
Mm-hmm.
I look at one of my grandmother's caregivers now. She'll just bring cakes and pies and just to put a smile on her face, and that's a true caregiver's heart. And I think it's also important to note that the face of caregivers is changing.
Yes.
There are approximately 43.5 million unpaid
Yes.
caregivers.
Mm-hmm.
These are not caregivers or home care workers who are doing this by profession. These are people who are now taking care of their family members.
Mm-hmm.
And so when you are in the workforce and now you either have to come out of the workforce to take care of the loved one, or you're now juggling
Mm-hmm.
being still employed and taking care of your family member, that's really tough to do. And so it's important, the work that the union is doing is very important to help those home care workers and caregivers make that transition from um, having a completely different life and lifestyle, losing income,
Mm-hmm.
to now work with,
Yeah.
low wages. So I think we just had a great conversation. Was there anything else that you wanted to share with the viewers again about the union, and about what the needs are, and just anything that you want to put out there that you want um, the average person and legislators to know about home care workers and what's going on with the union?
So a couple of things. One, every Wednesday at 3 o'clock, we do a caregivers call. That's a call for all caregivers to get on the call. We have done different trainings. We've done PPE, proper PPE wearing, um, some nutrition stuff. Um, we've done how to talk to your legislators, how to make a call. We've also done lobby calls. We've done lobby calls with a lot of our legislators because I can't stress it enough that home care is funded by the state. That means that the Department of Human Services, which governs the state in Medicaid and Medicare dollars, Medicaid mostly, Medicare is through federal government. So Medicaid dollars come into the state and they say, you know what, this program, home care program, we want to fund it. When they start talking about cuts, they start talking about Medicaid first, and that actually direct ties to home care. Want to make sure that people know that, like, the people that we put in office is a definitely we need to know where they stand in home care. And so we have lobby calls every week. We have caregiver calls every week. And we also have something that's called Ask a Nurse. If there's any kind of questions that you might have, we're on the Facebook, United Home Care Workers of Pennsylvania. It's a little blue house. But we have nurses calls on every Thursday from 4 to 5 that you can ask a nurse anything that comes across your mind or you have a question about or whatever, and you can get online and talk to her. She's a licensed nurse. She does our trainings for our CNAs. So she's really good, and she's a very nice person. Um, and we are doing these calls every week, and we will continue to do these calls until um, we find it necessary not to do them. But I think because of COVID-19 and the way that we have to communicate with people is always going to be through, right now, this is the way that we're going to be communicating with people. Um, but we want to let people know that we are here and um, we are fighting. Every single day we're talking about how do we make things better? How do we do things better for home care? Because home care is in the front of all of this. Make no mistake about it. You are definitely on the top of the list in reference to essential personnel, because without you, the people that you take care of wouldn't be able to stay in their homes. That and we say that all the time. So I just want to just say that those are the things that are going on. And we're still, like I said, we're still fighting to see whether or not we can get more money for home care workers. That's something that we are continuously going to fight for. Better trainings. It seems like the percentage on rate increase is going to, everybody's fighting for more monies for home care workers. So, and just because of the COVID-19, they realize how essential home care workers are, and how important it is to make sure that you can do your work without being concerned about how you're going to do everything else in your life. We're doing trainings on Alzheimer's, on dementia, on anything that you feel deem, any home care workers deem necessary, that they say, well, you know what, I want to know about this, and we have the monies to do it. So all we're asking for is um, people's opinions, or what do they think that they would like to have trainings on, and we'll be able to provide it. So we do that every single week.
Well, this has been a wonderful talk, and I hope that it's been educational to the audience. How can someone contact the union if they're interested in more receiving more information or joining?
So they can contact, we have a member resource, and it's an 800 number. So it's 1-800-252-3894. 800-252-3894. That member resource center. And that member resource center can answer any questions. If they need to get in touch with me, they know how to get in touch with me as well. So you can call them if you're interested in joining, and if you're interested in being a part of our conversations that we have every week.
Well, Robin, I want to thank you so much for joining the Caregiver Society for this important discussion on underpaid and not protected segment of coping with COVID-19 series. I'm your host, Kierny Warren, and thank you for watching. And until next time, be healthy and safe. Thank you.
Thank you.